Madison.
When the radiologist reads the mammogram, there are certain terms they need to use so that when the surgeons read those mammograms, we all know what we're talking about. Okay, there's scripted. And the breast density is basically in 4 different categories. So at one extreme we have the very fatty breast, and at the other extreme we have the extremely dense breast, okay? And most of us are in the middle, okay, in the other 2 categories. So only about 10% are fatty and 10% are extremely dense. And please, Dr. Davis, correct me if I'm wrong in that. And then 80% in our middle categories. When we look at is one breast type more likely to develop cancer, okay, there are many different risk factors that we look at. And an extremely dense breast actually does increase your risk a little bit compared to somebody with a fatty breast. Okay, so we have the issue of, okay, it's harder to find, okay, and yes, there's a little increased risk. You know, statistics are kind of funny. You can change numbers, and I can tell you that I can give you a medicine to drop your risk by 50% if you take this medicine, but if your risk is only 2%, okay, 2 in 100, I'm going to give you this medicine and I'm going to make it 1 in 100, okay? So when we look at, okay, dense breasts, yes, there's a higher chance of cancer. When we look at everything that's involved, it's a small increased risk.